Muy buenos días a todos y todas. Voy a iniciar en español, pero posteriormente daremos paso al inglés porque esta conferencia va a ser en inglés y va a tratar sobre educación, clima y salud. Today we have invited Dr. Cecilia Sorensen, which is the president of the Global Consortium of Climate and Health Education. So she's a very important woman. She's an associated professor of the Department of Environmental Health Sciences. Also, she works in the School of Public Health and she works in the Department of Emergency Medicine. So she has a lot of versatility in these topics and she works in a lot of places. She's now in the Irving Medical Center in New York, and she's going to talk to us about all this relation between education, climate, and health. That is really a little bit new here in Colombia, although here at Javeriano, we have been working with some professors around this topic. Dr. Sorensen has been doing a lot of research translating the results into policy, clinical action, and education in order to build resilience in vulnerable communities. She has worked in a lot of places. One of them is Guatemala, and she also worked in Ecuador following the earthquake of 2016, and in Puerto Rico also. She's a very important woman in this topic, and we are really very felices, grateful to receive you here, Doctor. So the audience is for you, Cecilia. Please go on.
Thank you so much for the introduction, and thank you so much for inviting me to be here today. Today I'm going to be talking about what I'm calling the next horizon, and that is referring to the next climate horizon and how we can train health professionals to take care of patients both now and in the predicted future with climate change. So I have no disclosures to declare. So I want to start out by saying that, you know, I believe we are truly living in unprecedented times in humanity's history. It's said that we are the first generation to really feel the impacts of climate change. And at the same time, we're the last generation that can do anything about it. And, you know, this past summer has really been an incredible preview of how climate change impacts human systems and what we can think to expect in the coming decades. So this year we witnessed intense drought in the southern Amazon and a shift whereby the Amazon is now emitting more CO2 through wildfires than it is absorbing. We saw deadly floods sweep through Germany and parts of Belgium when intense storms dropped as much as 15 centimeters of rain in less than 24 hours. And in late June, Western Canada and the Pacific Northwest of the US were caught under a heat dome with record-shattering temperatures that were said to be virtually impossible without human-caused climate change. And these are just a couple examples of what we've been seeing in terms of extreme climate-related events across the globe just this past summer. So why are we talking about health? You know, when it comes to climate change, clearly all forms of life on this planet are affected, including polar bears. However, as unabated climate change continues, I really believe that human health is going to be the common final endpoint and the impact that's going to have to drive us towards making action to rectify the course that we are currently on. So as we've seen, increased temperatures, more extreme weather, rising sea levels, and extremes of precipitation have resulted in a wide variety of health impacts. And that includes population displacement, poor birth outcomes, changes in vector ecology, increased allergens, difficulty with food supply and food quality, physical trauma, gastrointestinal disease, and more. So the other reason to talk about climate change and health is that if the global healthcare sector were a country, it would actually be the 5th largest emitter of greenhouse gases on the planet. So we're stuck in this paradox whereby in addition to doing a great deal of good in the communities we serve, we also inadvertently do quite a bit of harm as a result of the resource utilization of the health sector. Additionally, we know that health sectors and health systems are highly vulnerable to the impacts of climate-related disasters, such as wildfires and hurricanes, which in turn leads to cascading impacts on the health of those infected communities. So with the recent release of the IPCC sixth assessment report, we know for certain that climate change is widespread, that it's rapid and intensifying, and that without immediate and large-scale reductions in greenhouse gas emissions, we will soon see warming of 1.5 to 2 degrees Celsius, likely within our lifetimes. And as we just discussed, already with only 1 degree of warming, nearly every region across the globe is being affected by climate extremes with untold impacts on health. So it's said that climate change is the biggest global health threat of the 21st century. While at the same time, it's said that tackling climate change could be the greatest global health opportunity. However, in order to turn this risk into an opportunity, what we need are knowledgeable health professionals who understand the interconnection between climate and health and who can lead planning and analysis and translate best practices into policy and into education. So a fundamental question in our quest for this way forward is, what do health professionals need to know? Or said another way, how will climate change affect our patients and affect our clinical practice? So to meet this need to advance health security and to prepare this generation of health practitioners for a hotter, riskier, and more complicated future, the Global Consortium on Climate and Health Education was launched in 2017 with its home at the Mailman School of Public Health at Columbia University. Already, we have over 220 universities globally who have committed to the mission to educate their health professional students on the impacts of climate change and health. And currently, we know that over 65% are offering education on climate and health. Now, since its inception, the consortium has been creating and iterating core competencies for health professionals. These are competencies which are updated annually and are vetted by our consortium members to really serve as a framework for building curriculum and for driving interdisciplinary collaboration. So the three main competencies include climate and health knowledge and analytic skills, climate change and public health practice, climate change and clinical practice, policy aspects of climate change, and climate and health communication. Now, given the scale and the challenge that climate change brings, we really have geared these competencies to support and to promote interdisciplinary cooperation, both in education as well as in professional practice. Because to really fully address the climate and health crisis, every type of health professional needs to be able to be savvy and to be competent to understand the health implications. So one way to think about the health system response to climate change is to really examine the professional roles and responsibilities, especially as these relate to primary prevention, secondary prevention, and tertiary prevention. So when it comes to primary prevention, really the core of this is climate mitigation, or efforts to slow, stabilize, or reverse climate change by reducing greenhouse gas emissions. So climate mitigation is really foundational to combat current and future health impacts. So many agree that health professionals have the shared responsibility to articulate the need for rapid decarbonization to policymakers, to stakeholders, and to the public, and to articulate the economic and health co-benefits of decarbonization. I would say we also have the shared responsibility to address carbon mitigation and disaster preparedness within the health sector. Simultaneously, health professionals must also be able to understand and articulate climate-related health threats with accompanying steps that can be taken to reduce individual and community risk. So in doing so, health professionals must acknowledge, inventory, and address the gaps in our knowledge. For example, there are many opportunities for scientific investigation related to population vulnerability, hazard identification, risk management, and other which warrant a multidisciplinary approach. The foundation of secondary prevention is climate adaptation, and this is where we seek to limit the harms of climate change. And the clinical community has a huge role here. Their responsibilities are to understand and utilize information gained from the public health analysis to create targeted interventions to address threats to individual health, as well as to create, update, and adjust specialty-specific and demographic-specific health guidance and treatment standards to decrease anticipated health burdens. If a lack of public health information exists, clinicians must be able to independently identify social, physiologic, and environmental factors that increase vulnerability and take steps to identify resources and develop best practices to make health protective recommendations to their patients. Simultaneously, clinicians must work closely with health system leaders and public health to undertake health system vulnerability assessments to prepare for climate-related hazards that directly impact health system infrastructure, as well as supply chains and human resources. We need to work together to assess vulnerabilities and address them with wide cooperation between regional hospitals as well as healthcare systems, and in close concert with government interventions as well as public health boards. We also need to focus on tertiary prevention. And this is kind of the category of, putting out the fire, because we are already seeing severe impacts from climate change in many places. Tertiary prevention involves reducing cascading health burdens once climate impacts occur, both acute and chronic. And so here, the clinical community really needs to actively participate in local and regional as well as disaster management. We need to work to establish best practices for healthcare system management in the face of compounding disasters. We need to be able to assess patients for psychosocial as well as health-related impacts related to extreme events, and to relay that information back to public health and to generate resources to help patients. So ultimately, our goal of tertiary prevention is to ameliorate cascading impacts to human health in the wake of climate impacts by creating health systems that are prepared for crisis situations with robust communication and planning networks involving all necessary sectors and stakeholders. So just as an example, let's take how we might respond to a heat wave, which we know are becoming more common under climate change. So during an event, we know the medical community is responsible for establishing clinical protocols and participating in regional disaster planning. Public health professionals must create and activate health advisories, establish cooling centers, identify vulnerable populations, and more. The nursing community is responsible for educating patients as well as for providing clinical care. And our EMS is responsible for on-the-street disaster mitigation and management, while our social work colleagues are needed to create safety plans and check in with vulnerable patients. So what you can see is that in order to have a really functional and robust response to climate-related threats, every part of the medical system needs to be working both in their own field, but also in concert with other fields in order to really safely protect health. So then the question becomes, if this is the ideal of what we're striving for, this very intricate and well-in-sync system, how can we train our students to be competent leaders in climate and health now and in the rapidly approaching future of 1.5 degrees of warming? So based on our work at the consortium, we've seen many different approaches for how climate change can be integrated into existing health professional curriculum. We've seen schools integrate climate and health in a longitudinal fashion over the course of the degree. We've seen schools that have embedded climate and health issues within core systems-based learning. We've seen intensive 2 to 4 week courses be launched that all medical students take, for example. There are master's level certificates in climate and health that have come out of public health schools as well as medical schools. We've seen, especially in public health schools, climate and health concentrations, and we've seen even masters of science in climate and health coming out of some public health schools. So here's just a couple of examples of this. At the University of Cape Town, leaders are building a longitudinal curriculum where climate and health is incorporated into all years of medical training, as well as within the schools of physiology, speech therapy, and occupational therapy. And in Kenya, Kenyatta University has a dedicated master's program of environmental health studies in climate change and sustainability. And at the London School of Tropical Medicine and Hygiene, they have a public health track where students explore climate equity and climate risk as they apply it to sustainable development, as well as environmental health policy. And at Mount Sinai in New York City, leaders are incorporating climate and health in a longitudinal manner throughout their medical training. So there's really so many different ways that this can be incorporated. And what I'd like to do now is give some examples of how to incorporate climate and health into existing medical curriculum, because this is really, I think, one of the easiest ways to integrate climate and health, and a way that can be done very quickly. So let's start out by looking at heat. So we all know that the world is heating up and that on average temperatures have increased roughly 1 degree Celsius since pre-industrial times. However, it's important to know that climate change increases the variance as well as the mean in global temperatures, meaning that we are seeing much more extreme heat waves as well as a shift in average temperatures. In terms of health, we are all familiar with heat illness, correct? And that includes heat stress, heat stroke, heat syncope. But in addition to causing heat illness, heat worsens cardiovascular and respiratory disease, and additionally increases the risk of renal failure. It's also been found to be associated with interpersonal violence, assault, accidental trauma, as well as pregnancy complications such as preterm deliveries. And it's important to know that the threshold at which increases in temperature cause harm to an individual really depends on many factors, including pre-existing health conditions, as well as acclimatization. So heat illness is really a disease of vulnerability. And for some, even small rises in temperature can have tremendous health implications. So how and why does heat cause so many problems? We know physiologically, heat activates inflammatory pathways, it alters coagulation cascades, and it alters central nervous system control of the heart. And this can lead to cardiovascular events as well as cerebrovascular events, including arrhythmias, myocardial infarctions, and strokes. Heat is also especially dangerous for patients taking any medication which interferes with fluid balance, such as beta blockers or diuretics, as well as medications such as antipsychotics and SSRIs, which interfere with central thermoregulatory centers. So just as an example, in this study from 2012, Basu and colleagues in California looked at 1.2 million ED visits and used models to see the effect of same-day temperature on the presentation of various heat-sensitive illnesses. They found that for every 10-degree Fahrenheit rise in temperature above the seasonal average, the relative risk of ischemic heart disease rose 1.7%, the risk of ischemic stroke and cardiac dysrhythmias rose nearly 3%, the risk of hypotension rose 13%, dehydration 25%, acute renal failure 16%, and heat illness almost 400%. So these impacts are happening, and they're happening not just in extreme heat waves, but they're happening even when we see slight rises above normal seasonal temperatures. Now, in addition to acute impacts, heat can also contribute to chronic renal disease. So during the past 2 decades, there's been an epidemic of this mysterious kidney disease, which has been dubbed Mesoamerican Nephropathy. It's also been called chronic kidney disease of unknown origin, which has been reported to have killed nearly 60,000 farmers in Central America, but it's also being seen in Sri Lanka, as well as India, Egypt, and even in California. And this form of kidney disease primarily affects men in the prime of their life, between the ages of 20 to 50. It tends to affect people who are manual laborers working in high-intensity agriculture. And the difficult part about this disease is that it's often diagnosed very late in the course when people have very late stages of kidney failure. And in many of these communities, there's no access to dialysis. So many of these men end up not being able to work, unable to support themselves and their families. And this has very wide-reaching implications for community health and even for global food security. And so many of the lines of evidence as to why this epidemic is occurring are being linked to heat illness and to heat stress and the impact on the kidneys of repeated exposure to very high temperatures. So how can we teach this type of information to students? One way I think that is particularly accessible is to use an organ system approach. So for example, in regard to renal health, students can be taught to understand the pathophysiology and risk factors for rhabdomyelinosis, kidney stones, and acute kidney injury during heat waves. Students can be taught to provide anticipatory guidance to outdoor laborers or other at-risk populations for heat stroke and acute kidney injury in the setting of extreme heat. Our students can be taught to elicit a thorough occupational and environmental history to be able to identify workplace factors that can mitigate the risk of CKDU for vulnerable populations. So before I came to New York City, I was working in Colorado, and we have a lot of immigrants from Central America and Colorado. And I would be working, for example, in the emergency room, and I would have a totally otherwise healthy, man in his 30s come in with pneumonia, and, you check his kidney function. And why does he have, an EGFR of 25%, right? And then when you take more of a history, you understand that he actually has been an agricultural laborer for his entire life in very, very hot climates. But this is not information that's readily known among many medical trainees. The other thing we can teach students about health would be to look at the cardiovascular impacts. So for example, if we're teaching a module in basic medical science on the cardiovascular system, you can integrate heat and recognize heat stress as a potential trigger for myocardial infarction and arrhythmias, and teach students to provide appropriate anticipatory guidance to high-risk patients. We can teach students to understand risks associated with taking diuretics and blood pressure medications during heat waves. And this is especially important for students who are working in the clinical environment and who are counseling patients. We can also teach students to understand the time interval during which patients may be at high risk of increased morbidity and mortality in the setting of heat waves, again, because they are in the clinic and they are providing a lot of one-on-one care for patients. So shifting gears, I'd like to provide one other example of how we can integrate climate and health, looking at air quality. As you know, the burning of fossil fuels releases volatile organic compounds, as well as nitrogen oxides, which in the presence of heat and UV radiation form ozone. And the burning of fossil fuels also emits a ton of fine particulate matter. So the resulting poor air quality has been shown to diminish lung function, to exacerbate chronic respiratory diseases, to increase hospital admissions and ED visits for asthma and COPD, as well as to adversely impact pregnancy outcomes and lead to premature mortality. And the burden of this hazard, we found, is placed predominantly on minority and low-income communities, although the World Health Organization estimates that nearly 90% of the world's population currently lives in areas where air quality exceeds recommended health standards. Physiologically, ozone and fine particulate matter cause chronic and acute pulmonary inflammation, and particles less than 2.5 micrometers can actually cross the alveolar capillary membrane and enter the bloodstream, where they cause inflammation and injury to blood vessels and can accelerate the development of atherosclerosis and worsen microvascular complications of diabetes and hypertension. So just for an example, although smoking is the greatest risk factor for COPD, more and more evidence is being gathered about the effect of air pollution on COPD. So there's been some bigger studies in the UK as well as China, which have shown a positive association between exposure to high levels of air pollution and decreased lung function and the development of COPD. And this graph is a study from a study conducted in Canada that found that high levels of air pollutants can lead to increased emergency department visits for exacerbations of COPD, even up to 8 days after the exposure to the poor air quality event. We've also seen that exposure to coarse and fine particulate matter has been associated with increased asthma diagnosis, as well as prevalence, hospitalizations, and emergency department visits. Additionally, air pollution exposure has been found to have a large role in the development of childhood asthma, especially in urban environments. And overall, this ultimately leads to increased healthcare costs, as well as a reduced quality of life for asthma patients. We also know that people with underlying coronary artery disease are at a larger risk from short-term exposure to PM2.5. We found that exposure to PM2.5 increases the relative risk for having an acute myocardial infarction, even when there's only an increase of, let's say, 10 micrograms per meter squared, which is, you probably wouldn't notice it just walking down the street if there were that increase. But if you have underlying coronary artery disease, this could be a huge risk factor for you. Simultaneously, we found that even relatively low levels of exposure to particulate matter can contribute to atherosclerosis and other cardiovascular risk factors. Now, we know that the physiology of air pollution is diffuse in our environment, that really every patient is affected by this. And because of that, nearly every system or organ of the body is affected. So there's so many opportunities to really teach students and so many opportunities for integrating this into curriculum. So for example, when teaching about pulmonology, it's important that students understand the role that climate change has on increasing ground level ozone as well as fine particulate matter. It's important that students understand the mechanisms by which air pollution, and particularly PM2.5 and ozone, contribute to the development of asthma and to exacerbations of asthma and chronic lung disease. It's important that students are able to design asthma action plans that incorporate specific instructions on what to do when the air quality is poor, and so on. In terms of teaching in cardiovascular blocks, it's important that students recognize that PM2.5 and ozone are risk factors for atherosclerosis, and that exposure to acute and chronic high levels of poor air quality can be a trigger for myocardial infarction and arrhythmias. And it's important that students know how to counsel patients that are at high risk. In terms of reproductive health, we know that exposure to poor air quality is associated with poor pregnancy outcomes, such as premature birth. And in neurology, we understand that air pollution can increase the risk for stroke via its impacts on endothelial damage. So understanding the broad impacts of air pollution on health, we can begin to really, in a very focused manner, input these types of learning objectives within existing curriculum to help students become more prepared for the environment realities that we are facing now and that we will continue to face. So just going back to this overview, we talked about heat, we talked about air pollution, but there's many other exposures that are relevant depending on where you are geographically. For example, changes in vector ecology, exposure to dengue or Zika virus, allergens, food supply. And so depending on where the students are practicing, there may be different modifications that could be taken in the curriculum to make the students more ready to take care of patients being affected by these climate impacts in their region. So at the consortium, our mission is to ensure that 100% of health professionals globally have the knowledge and skills to recognize, respond to, and prevent climate-related health impacts. Our second mission is really to organize, empower, and amplify the voice of health professionals to convey how climate change is harming our health and how climate solutions will improve it. However, we realize that there are so many intricacies to this work and recognize that each institution and each region has very unique demands. And our goal is to work with each of our members to really help them design a curriculum that's very dialed to their needs in their regions. So our approach is that we obtain commitments from health professional schools to educate their students on the health impacts of climate change and then support them in this work. As I mentioned, we already have 220 schools, as well as 3 large association members, including the Association of Schools and Programs for Public Health, which is in North America, as well as the Association for Schools of Public Health in the European region, and the Islamic Medical Association of North America. Next, we bring together member institutions to create and share best scientific and educational practices. And this occurs through monthly member webinars, whereby schools partake in sharing their curriculum and discussing their challenges and their successes. We also develop global standards and resources on climate and health education for health professional schools. As I mentioned, we recently updated our core competencies. We also have an extensive knowledge and resource bank that is open source and free and available to the public. This year, we will be creating a toolkit for integrating climate and health into medical curriculum, as well as nursing curriculum. And we are looking for how we can translate this into different languages, as well as different regions to make it more appropriate. We are also working to build a pipeline of health professionals who focus their work on climate and health. And this year at the consortium, we have a student fellow, Natasha Sud, who's coming from Penn State, as well as a physician fellow, Stefan Wheat, who's coming from Colorado. Additionally, this spring, student Dr. Juan Francisco, who is a medical student from Pontificia, will be joining us in New York City for his internship, and we are so excited to welcome him here. We also have recently launched a student committee, and the goal of this is really to bring the student voice to the consortium. They are hosting their own events. They have a student blog. They have many student opportunities that are listed on the website, and we welcome any interested students to join our student committee. We are also in the process of launching several other initiatives in order to increase education and communication across regions. So one of these is the Climate and Health Rapid Response Initiative. We recently launched this in order to provide real-time information and education on climatic exposures and resulting health impacts. Through these webinars, experts come together and assess emergent health needs, as well as health system impacts of the event and opportunities for bolstering public health system responses. The goal of these events is to increase climate and health literacy, as well as to improve coordination and response between clinical and public health practitioners, as well as to explore best climate science available. And these events are all free and open to the public. We are also in the process of creating a 12-week training program for health professionals in climate and health. This course will be based on the consortium core competencies and will review major climate and health topics through didactic sessions, as well as case studies and skill sessions. We're planning to initially start the pilot of this in winter of 2022 with a North American focus, but we are also actively looking for partners to start a pilot in South America as soon as possible. Participants will receive free CME as well as a certificate from Columbia University and any other affiliated universities who are part of this initiative. We're also partnering with Healthcare Without Harm, which is a large NGO based in the US, which focuses on mitigation of carbon in the health sector. And we will be hosting quarterly grand rounds lecture series that are focused on international as well as domestic audiences. So lots of different activities going on right now. And there are so many different ways to get involved. So for example, we would love to help you launch a climate and health rapid response related to a topic of regional importance in Colombia. We invite you to use the GCCHE core competencies to integrate climate and health into your curriculum. And we would also invite you to share educational offerings through our member webinars and to encourage other schools in the region to join. So we're delighted to have you as a member of the consortium, and it's just been fantastic to see things grow over time. So thank you so much for having me here today, and I look forward to hearing your questions and to having a discussion.
Dr. Sorensen, for your excellent presentation. I think it invites a lot to think around these topics and to make some new things here in Colombia. The university, if you are looking to associate to make the pilots here with the students, it will be very fine for us to help you with this. Very interesting for us. So I will open the questions. Si alguien tiene preguntas en español, las podemos traducir acá con mucho gusto. Si hay alguna duda o alguna pregunta. I'm asking to tell us the questions in Spanish if the persons need it, and we are going to begin with a round of questions. It's okay for you, Dr. Sorensen? Okay. Ilma Montilla, ¿quieres preguntar algo?
Well, first of all, I just want to thank Cecilia for being with us. I think it was a wonderful presentation, and I think it gave us like an overview of what the Global Consortium can do and how we can support the initiatives. I would like to ask you if you can elaborate a bit about your experience teaching clinicians on these topics.
Sure, absolutely. So, when I was at University of Colorado, I taught a medical school elective. So because we found that it was very difficult to get climate and health integrated into the main didactic curriculum at the school. There's so many reasons why. I mean, there's not enough time, there's not enough space in the curriculum. So the approach that we took was that we started by having an elective, and it was optional. And the first year we had it, at 120 students at the university, we had 30 students register for it, which we thought was pretty good, given that it's a new topic and it's just totally optional. So we had a 2-week course, and the response from students was very robust. I mean, I found that the clinical students, they acknowledge, they know that climate change is happening, they suspect that it's impacting health, or they already know that it's impacting health, and they have heard nothing about this in their entire medical education. So I think for a lot of students, who showed up and said, "Oh my gosh, I can't believe you're talking about this. No one else is talking about this." So it was really sort of this aha moment for a lot of students. So we were running that course for 3 years, and in the 3rd year, the dean of medical school finally came to us and said, "This is so great that you're doing this. We'd love to fund this, 1, and 2, we'd love to incorporate this into core learning materials throughout the medical school training program." So we started out as an elective, and now we are getting more integrated into all core teaching topics of the school. So I found, in working with medical students, that they are very receptive to this. They know this is happening, and they're kind of relieved to be learning about it. When I'm working in the emergency room, I work directly with residents, and the teaching is a little bit more informal. For example, if there's a heat wave, we're talking to residents about how to recognize illness, how it can exacerbate other conditions, And so it's a lot more sort of informal and impromptu teaching. But when I'm working in the emergency room, oftentimes I'm also talking with, our charge nurses or our emergency room techs and talking to them about heat illness and what we're going to be expecting to come in that day. So we have resources ready. So if we're in a huge heat wave, I want to make sure all the nurses know that if we have a heat stroke fix come in, that we need to have all the fans ready. We need to have, ice packs ready. We have to make sure that everybody understands what to do. So I think that, as someone who's very facile in climate and health, I see so many different opportunities for integrating education, and I think it can be done formally, and I think it can be done informally. I think what we need are more educators, more people who really understand the science and the impacts to be people in medical schools, in clinical environments, furthering knowledge and education.
I don't know, Dr. Sorense, we have some problems with your connectivity maybe, and we don't hear you very well. I don't know if you could do something around that, because we are receiving your voice, but very
very fragmented.
Yeah.
Okay. Maybe I can try stopping my camera. Sometimes that helps with the wavelength.
If you could respond us a little bit, this topic you work a little bit now around education. If you could do it again, it would be wonderful for us.
Okay. Can you hear me okay right now?
Yes, nice, very well.
Yes.
Yeah.
Okay. So let me be a little more brief. When I've taught these types of courses in climate and health to medical students, I've had an overwhelming response from students. I think they know that climate change is happening. They know it's affecting health, and they are relieved to be having their professors be talking about it, because honestly, when I teach it, it's the first time they've ever actually heard it be acknowledged formally. And so I've had an incredible response from students. Honestly, it's students who have been pushing forward a lot of curriculum. So at University of Colorado, we have an elective where we've been teaching a 2-week course for the past 3 years. And just in the past year, we now have integrated into all years of medical training. So really the response from students has been overwhelming, and they definitely want this information, is what I've found.
Mm-hmm. Okay, thank you. Thank you very much. Someone is asking here around, excuse me, I will try to see the question here. It is around, excuse me, es que las preguntas, ¿cómo puedo verlas bien? Que ahora las vi, pero se perdieron, Laura.
Doctor, ¿le parece que todavía no tenemos comentarios? Acá tenemos uno.
Many thanks for your presentation. I would like you to ask if your team is working with professionals from other disciplines, for example, agriculture experts and nutritionists. This is from the Professor Gomez. He's working in public health here. Dr. Sorense.
Yeah, that's a great question. We're actually working right now on how to integrate climate and health topics into all of the professional schools at Columbia University. So for example, we're building modules to integrate into the schools of engineering, as well as the law school, as well as the business school, and the faculty in those departments to try to make climate and health relevant to the topics that they are covering. So I think that there's a lot of work that needs to be done in order to bridge these silos. So I can't say we're working specifically with agricultural experts or nutritionists. I know a lot of people do research on climate and health, but we are not focusing education in that sector quite yet, although I think we could and we should.
Okay, thank you. Other questions around your course, the course you are going to offer to to the community, it is free, or it has some cost for the persons that go inside that course?
So the goal for the 12-week course is going to be that it's completely free, and that they will get an associated certificate from Columbia University, as well as continuing medical education credits. So no, the course will be free.
Mm-hmm. Okay. For the students and the professors that could be interested to go to make some work with you, or maybe going and learning some things for a small period of time, like a fellow or something like that, it is easy, or they have some time of requirements to go over there?
We are very flexible, and we're very open to having students come. So for example, one of the medical students is coming for about 2 months this spring. And depending on how much time they have, we will be able to sort of identify a discrete project for them to work on. You know, it's not even necessary for someone to come all the way to New York. I mean, so much of this work can be done virtual. So we welcome any students or fellows who are interested in this to contact us, and we're very happy to help them, find a project of good meaning and help them get involved.
Excuse me. Actually, as Cecilia was telling, we are going to have an intern that is one of our students, Juan Francisco Campos, and he will be doing the internship with the Global Consortium. And what we're planning to do is trying to support the development of the curriculum for South America, based on the course of what Cecilia was saying. So I think that's part of the thing, as she said, that we can have different students, even we can have residents that could be also interested in these topics, and try to find out around the framework of the Global Consortium what they can do in terms of how to support the region or the country, or even, for example, the university in terms of the development of the curriculum.
Okay, wonderful. Also, you are working some type of research being done by the network with different results in each country, but the same protocol for all the countries, or you are not thinking in that at present, Cecilia?
So with the curriculum, we are using the core competencies to build the framework of the curriculum. But what we think is very important is for it to be regionally applied. So for example, the risks in North America from climate are different from South America, different from India, different from Africa, right? So the goal is to use the same framework, but to bring in experts from each region to really make it regionally appropriate. And so that's what we'll be working on over the next 6 months, is to identify regional experts in South America who are going to be the best to be able to speak to issues that are most relevant for the region.
Okay, wonderful. Thank you, Cecilia.
But I just want to add, in terms of the research, I think what the consortium will focus right now is to try to give the basic for the health professionals, and from that work on research questions based on the region. And from there, we can have like a research network on climate and health. That's like the purpose of the consortium as well.
Okay, thank you, Gilma. Other question from somebody? Otra pregunta, si tienen, por favor. Okay. Okay, thank you very much. So, thank you very much, Dr. Cecilia. It was wonderful, a wonderful touch, and we will be expecting all the results of this with Gilma and all the group here. We will be proud to help you and to develop whatever you think it could be that can help the consortium.
Thank you so much, Dr. Gomez, and thank you so much for having me here today. And I look forward to future collaboration in this space. And thank you, Hilma, as well.
Okay, thank you very much.
Thank you, Cecilia. Okay. So we will follow up on Juan Francisco internship and also on the other initiatives that you were telling to see how the university can support the work of the consortium. Thanks a lot.
Okay.
Thanks.
Thank you so much. Have a great day.
Okay.
Bye.
You too. Bye.
Bye-bye, Professor Ensign. Bye.